Dr. Goldfarb, you're aware that there's a disproportionate incidence of maternal deaths amongst black women. What can you do to address that without involving race?
Thank you very much for that question. You know, the University of Pennsylvania, I've been very proud of one thing that they've done lately is to tackle this directly. The chairman of OBGYN there is a woman named Elizabeth Howell, who's made her career studying this issue of black mortality, maternal mortality. And what they've done is two things to prove my point that the whole issue is better access.
Well, even controlling for access to health care, education, and everything else, there is still a disparity. And how do you address that without involving discussion about race?
But it's not controlling for seeking out health care. It's not controlling for having health care delivered to you. So if I may say, two programs that they put in place. One is they created teams that were focused on any hemorrhage that might occur during the time of delivery, and this improved mortality across the board, including in white women who were also dying because of mortality during delivery. The second thing they did was to supply telehealth measures in order that blood pressure would be followed up after delivery, and they've reduced maternal mortality by 30% in that example. Black women have a 40% less frequency of getting first trimester prenatal care, and therefore that deficiency is an important part of the increased maternal mortality because the deaths occur due to severe hypertension that occurs at the time of delivery. So I think the literature on this is very complex. What's considered maternal mortality involves something up to 6 weeks after delivery as well. There are a lot of social issues involved here, but the issue that I have focused on is it's not because the women are being mistreated when they show up to have their babies. And I think it's black women are now quite terrified to come in and deliver their babies in hospitals because they've been told that this kind of bias is going on, and it's just not correct.